Incident management and reporting is key to harm prevention and enables controls to be dynamic and adapt to the changing circumstances and conditions that we work in. It is key to safety and harm prevention programs and underpins the continuous improvement of control systems that prevent harm from occurring. It enables organisations to learn, improve and adapt to the constantly changing world in which it operates. There are many benefits to having an effective incident management system, including to prevent or minimise human suffering from injury, illness or abuse, minimise avoidable impacts on people, the organisation and environment, and most importantly, it demonstrates personal and organisational commitment to harm prevention and safety of employees, contractors, clients, volunteers, congregations and the general public. By definition, an accident generally implies an outcome of an unintended nature. Experts in the field of harm prevention avoid the term accident to describe events that cause harm in an effort to highlight the predictable and preventable nature of most events that result in harm. As such, incidents are viewed from the perspective of usually being predictable and preventable. At Ansvar, our view of an incident is that every incident has the opportunity to provide insight on potential future events. An incident is often a precursor to some future event. And if we have a systematic way of collecting and analysing these apparently disparate and unconnected events, we can sometimes use that information to be proactive in harm prevention. Our view is that every incident has the opportunity to provide insight into potential future events. Therefore, we encourage reporting of all incident types, including near misses. Our definition of an incident is therefore any unplanned event that occurs as a result of work or activity undertaken at a workplace or public or community space that results in or has the potential to cause harm, injury, ill health or other loss. Incident reporting around behaviours of concern or code of conduct issues are vitally important to identifying and preventing potential abuse. In terms of creating safe places free from abuse, the Royal Commission into Institutional Responses to Child Sexual Abuse identified 5 key areas of control that are most effective in preventing abuse. One of those is incident reporting and response. They also identified the key elements of an incident reporting regime, which are critical to preventing abuse. That is that we recognise that mistakes will happen, and the goal is really to spot them quickly. Codifying behaviours of concern and ensuring there is a system for reporting and responding to these behaviours. And simple, streamlined, accessible reporting system for all event types, including behaviours of concern. We are probably all quite familiar with the quip attributed to management guru Peter Drucker that culture eats strategy for breakfast. A poor culture, a blaming culture, is the enemy of effective incident management. It's important to incident management to be effective to have a just culture, and for this culture to be driven from the top at both board and senior leadership level. A just culture is one that promotes a questioning attitude, strives for continuous learning and improvement. It's both about attitudes to incident reporting and also having the structural elements in place to enable issues to be reported, managed, and importantly, for those involved in the incident, a timely response. It's also important in creating a just culture that we address the myths that exist around incident reporting and management. One of those is the perfection myth. That is, if we try hard enough, we will not make any errors, or it's possible for humans to be 100% accurate 100% of the time. There is also the punishment myth. If we punish people when they make errors, they will make fewer of them. This myth fails to take into account that other practitioners are likely to make the same error if there is no learning. Like all myths, these too are untrue. Wide acceptance of these myths by the health, care and community sectors leads to systems where errors are likely to occur and they are unlikely to be reported, or there is unlikely to be learning, organisational learning, from those incidents. Ansvar provides a range of solutions to help build our clients' incident management capability. We provide this support in 4 key areas: advice on control systems through education and training resources, assisting our customers to design and embed a comprehensive control environment relative to their risk exposures. We provide support in culture and leadership support through strategic workshops for boards and executive leaders, information and resources to assist leaders to create a just and safety-focused culture, promoting learning and continuous improvement by providing customers with sector-specific big data analytics and benchmarking reports. We also provide technology solutions to enable our customers to maintain effective reporting, recording and management of incidents. In conjunction with our partner Rapid Global, Ansvar has developed and made available sector-specific software packages that enable our clients to manage the whole incident management cycle, from reporting an incident, investigation, corrective action management, including a full suite of management reporting. This software is a key resource for our clients and is just part of Ansvar's commitment to contribute to and help build safer communities that promote wellbeing and peace of mind.